Hello. So once again, I am recording the chapter lecture. Today I'm going to cover chapter 28, begins on page 437 in the textbook. Chapter 28 covers the respiratory system. So function of the respiratory system is going to transport air or gases to and from the lungs, exchanges oxygen for carbon dioxide. Primary function is to supply oxygen to the blood. Respiration is the mechanism through which gases are exchanged. Anatomy of the respiratory system. First, we'll look at the upper respiratory tract. It includes the nose or nasal cavity, paranasal sinuses, pharynx and larynx, acts in conjunction with epiglottis to guard entrance to trachea and lower airways. The figure 21.1 diagrams the upper respiratory tract. This is on page 437. Next, we'll look at the diaphragm. This is a dome-shaped layer of muscle that lies across the bottom of the chest cavity. Breathing occurs as the diaphragm contracts and relaxes. Carbon dioxide pushed out of the lungs during relaxation. Oxygen pulled into the lungs during contraction. The lower respiratory tract is comprised of the trachea and the two lungs, two main bronchi. Bronchi then branch into bronchioles, alveolar ducts, and alveoli. On page 438 is figure 28.2, the lower respiratory tract diagram. Figure 28.3 of the lung diagram can be found on page 439 in the textbook. So the lungs begins on page 438. About 10% of the lung is solid tissue. Remainder of structure is filled with air and blood. Functional structure in two parts: conducting airways, bronchi and bronchioles. These are tubes lined by cilia and respiratory mucosa, cartilage which supports and cushions the bronchi. The respiration, this is page 439. Respiration is achieved through the mouth, nose, trachea, lungs, and diaphragm. When intrapulmonary pressure inside the lungs is lower than the atmospheric pressure outside the lungs, air can flow to alveoli. Inspiration, intrapulmonary pressure, less than 760 millimeters of mercury, which is the average sea level pressure. Oxygen enters through mouth and nose where it is warmed and filtered. Oxygen passes through the larynx and trachea into the two bronchi, branching into bronchioles, connecting to alveoli, which are grape-like clusters of air sacs. Oxygenated air passes through the alveoli into capillaries, travels into arterial blood. Carbon dioxide or waste product is exhaled. Colds. This begins on page 440. We're going to get into the diseases and conditions of the respiratory tract. And the first one we're going to look at are colds. So these are caused by viral infections that inflame membranes in the nose and throat. Antibiotics will not cure a cold or any other viral infection. Treatment is considered symptomatic. So over-the-counter drugs and common sense therapies, keeping warm, drinking fluids, treat the symptoms themselves specifically. The table 28.1 shows you a comparison of cold and flu symptoms. It is found in the bottom right corner of page 440. Coughs begins on page 441. These may be a symptom of a cold, flu, respiratory problems, or non-respiratory diseases. Most likely begins with an irritation of nerves in the respiratory tract. Non-productive cough is treated with cough suppressant. Productive cough is treated with an expectorant to help get it on out. Table 28.3 is a comparison of cough formula for non-productive versus productive coughs. And this table is found on page 442 and continues over to page 443. Decongestants begins on page 443. Oral decongestants relax the bronchial smooth muscle, shrink swollen nasal mucous membranes, reduce nasal congestion, increase the openness of the nasal airway passages, promote drainage of sinus secretions. Topical nasal inhalants act as vasoconstrictors, shrinking dilated blood vessels. Temporarily relieve nasal congestion, may cause rebound effect, making the patient dependent on use of topical decongestants. Influenza begins on page 444. Commonly called the flu, is caused by the influenza virus, type A, B, or C. Flu vaccine recommended for everyone, especially older people, children, and those with a compromised immune systems. Antiviral medications and pain meds can be used, but prevention is best. H1N1 is detailed on page 446 of the textbook. This is an influenza virus with symptoms similar to the regular flu. Sometimes it's also referred to as the swine flu. Vaccination is recommended, again, especially for children, elderly, and those with compromised immune systems. Rhinitis, still on page 446, is inflammation of nasal membranes and/or runny nose. Common component of colds and allergies. Treatment is considered symptomatic. Table 28.5 details nasal decongestants, and it can be found on page 445 in the textbook. Allergies. Allergy is the result of the immune system's reaction to a foreign substance. Allergen is a substance capable of causing a hypersensitivity reaction. Treatments would include antihistamines. This is page 447. Antihistamines and antitussives to alleviate the symptoms. Mast cell stabilizers to prevent initial allergic reactions and recurrence. Antihistamines are used to treat seasonal allergies, to dry up mucous membranes, and as a sleep aid. They affect the H1 receptor site, blocking the body's own histamine, so no reaction can occur. Table 28.9 is on page 448 in the textbook. It details examples of over-the-counter antihistamines, which are H1 antagonists used for cold and allergy symptoms. Table 2810 is also on page 448. This gives you examples of prescription and over-the-counter antihistamines, H1 antagonists for allergy. Table 2811 is also on page 448 in the textbook. This one gives examples of prescription and over-the-counter ophthalmic antihistamines. These are still H1 antagonists. Table 2812 is on page 449 of the textbook. This is a comparison of the degree of sedation of various types of antihistamine. The mast cell stabilizers, page 449, prevent allergen from attaching to mast cell, preventing mast cell from releasing histamine. Also called mast cell inhibitors and mediator release inhibitors. Most often to prevent asthma attacks, but can also be used to prevent allergic rhinitis. Table 2813 is on page 449. details mast cell stabilizers. Cystic fibrosis on page 450 in the textbook. This is a genetic disorder producing abnormally thick, sticky mucus clogs, leading to lung infections, breathing difficulty, digestive problems. Treatments include chest percussion therapy, physical therapy. That's where they're like literally doing percussion pats on the chest to help loosen up that mucus. Antibiotics, bronchodilator, and corticosteroid inhalers, nutritional supplements, and mucolytic treatment. Next, we'll look at asthma, also on page 450. This is a chronic respiratory disease characterized by inflammation of airways, tightening of muscles around airways. Bronchoconstriction occurs when the smooth muscle encircling the airways or tubes tighten, causing the airways to spasm. Treatment is palliative with albuterol and other bronchodilators. Table 28.17 details examples of prescription or over-the-counter antihistamines, H1 agonists, or allergy. And this table is found on page 454 of the textbook. Next, we'll look at COPD. This begins on page 451. COPD stands for chronic obstructive pulmonary disease. This is an umbrella term for emphysema and chronic bronchitis. It is characterized by partially blocked bronchi and bronchioles causing shortness of breath. Treatment may be palliative with bronchodilators. Treatment may be preventative with mast cell stabilizers. Emphysema begins at the bottom right of page 451 and then moves over into page 452. Emphysema is a shortness of breath, tachypnea, or rapid respiration after limited physical activity. External exchange interrupted when alveoli become permanently damaged. Prescription treatments include oral and nasal inhalation, injection, suppositories. Table 28.15 is on page 452 of the textbook. This details prescription treatments for COPD. Chronic bronchitis begins at the bottom left of page 452. This is characterized by inflammation of the airways that lasts for long periods of time or keeps returning. Main cause, first and second-hand cigarette smoke. Symptoms, shortness of breath, wheezing, fatigue, headaches, lower extremity swelling on both sides, and cough and large amounts of mucus. Cough with large amounts of mucus. Sometimes blood may be present. The treatment of asthma and COPD. Bronchodilation. Epinephrine stimulates sympathetic nervous system's beta-2 receptors. Bronchodilators administered orally include ephedrine, albuterol, and terbutaline. Stimulant inhalers open air passageways. Anti-inflammatory corticosteroids prevent inflammation. Treatments for quick relief to open air passages. Treatments for prophylactic maintenance. Beta-adrenergic inhalers act within 15 minutes. And sympathomimetic. Table 28.16, beta-adrenergic bronchodilators are detailed, and this is found on page 453 of the textbook. So still on the treatment of asthma and COPD, they will also use xanthines. It's a respiratory smooth muscle relaxants and anticholinergics, which block the effects of acetylcholine by competing for ACH receptor site. Anti-inflammatory agents, I'm on page 454 in the textbook, will slow acting inhibition. Glucocorticoids, sorry, struggling with that word there. These bind to glucocorticoid receptor, or DR, increasing gene transcription through transrepression transactivation. Mast cell inhibitors on page 455, also known as mast cell stabilizers, mediator release inhibitors, or prophylactic drugs. Table 28.19 details mast cell stabilizers and anti-leukotrienes. And that table is found on page 456 of the textbook. Anti-leukotriene drugs is on page 455. Leukotriene receptor antagonists and leukotriene inhibitors are available. Other treatments on page 456 would include things like atropine or oral medications that have much higher systemic concentration, so inhaled route is preferable. Pneumonia, also on page 456. This is lung inflammation caused by an infection. Symptoms can include chills, fever, fatigue, chest pain, coughing, and sore throat. Generally a serious illness that requires immediate attention. Treatments include antibiotics, antivirals, bronchodilators, and corticosteroids. Tuberculosis. This is a bacterial infection found in lungs that can spread to any part of the body. It is fatal if left untreated. Antibiotics, no alternative therapies or over-the-counters exist for tuberculosis. So table 28.20 on page 457 details the prescription treatments for tuberculosis. And as you can see, there just are not a lot of them. The summary on page 457 of the textbook: the respiratory system is crucial to sustaining life, responsible for providing all body cells with oxygen. Cold is most common respiratory system disease. Many serious diseases include asthma. Many respiratory diseases are treated with some form of inhalation therapy. And that concludes the lecture for chapter 28, the respiratory system. As always, if there's anything that you are unclear of, unsure of, a question comes up, you don't fully understand the material, the way that the textbook presents it, please reach out and we will work through it. I hope you have a great day, and until we